back to the MG Matters series, a part of the RDCN community, where we continue to discuss several topics that are of importance to the MG community, including clinicians who treat MG and patients. I'm Dr. Narayanaswami, and I have with me today Dr. Ali Habib. We are delighted to welcome you to a discussion of fatigue and its impact in myasthenia gravis. And I'm going to start off by talking a little bit about fatigue in our patients. We often see patients who tell us that they are struck by an overall sense of weakness, exhaustion, tiredness, or just loss of energy that's really disproportionate to the degree of physical effort that we put in. And I don't know about you, but I tend to sort of lump all of these into the category of fatigue.
Thank you so much, Dr. Narayanaswami. First of all, it's a pleasure to be doing this series with you, to be a part of this effort. And I agree with you in terms of putting all of these different terms and phrases that our patients use to describe what they feel as they battle their disease on a day-to-day basis. And in terms of how to go about thinking about it, it's actually really a challenge for us. We as a community are becoming more and more aware about this. I think there might have been a time where words such as fatigue and tiredness were kind of swept under the rug because we didn't have a great sense of how to put that in the context of myasthenia. But some recent studies have begun to shine the spotlight on this symptom, and it's becoming more and more a part of the conversation in myasthenia. It's still a very challenging thing to think about and conceptualize. A lot of us tend to talk to them about setting expectations that may be a part of their day-to-day struggle with the disease, and perhaps some coping mechanisms in terms of, pacing themselves and strategizing in that regard. But there are also other things that might be at play that are happening in our patients that are unrelated to myasthenia, perhaps. And that's something that we as physicians need to key in on as well.
Yeah, and that's a really good answer to start this topic because it tells us how broad it is. You mentioned that myasthenia gravis itself may be part of the fatigue story, or you mentioned certain other factors, medical factors. Can you tell us some of these medical factors that you ask your patients about or investigate them for when your patients talk about fatigue?
The first step that I take in addressing this is kind of seeing what their report of their overall MG symptoms, the symptoms that we do ask about in terms of their eyes, in terms of swallowing, speech, breathing, limb function, and also on our exam. And if those things are suggesting that the myasthenia really seems to be under pretty good control, yet the complaints of fatigue or tiredness are quite prominent in these patients, that really is where I begin to think of a dichotomy between them and think, well, what other factors might be at play? Do I need to do other investigations? I had an elderly patient, an octogenarian, who had been doing fabulous with her myasthenia. Every time that I saw her, she was doing really great. And one time she came in complaining of a lot of fatigue. And again, her MG specific symptoms and her exam hadn't changed much. Well, long story short, the investigations led to the diagnosis of colon cancer in her. So that just is an example to highlight how other diseases might be at play. I think some part of it may also be myasthenia itself playing into factors such as sleep disordered breathing. So in some patients who might have that, the myasthenia may actually be a contributing factor to making control more difficult in patients who have sleep apnea. And sometimes those things, controlling the myasthenia better, may actually play into improved symptoms from those conditions as well.
Although I agree with you about sort of looking at the control of myasthenia gravis, many patients across the spectrum seem to complain of fatigue. And I also noticed that despite optimal treatment of myasthenia gravis, that fatigue doesn't always go away. So again, that dichotomy, whether it's a different part of myasthenia gravis, and of course, what we can do now, as you said very clearly, is to look for things that can cause it. Now we're actually asking them about fatigue, or if we are not, we should be asking them about fatigue. How do you ask? Do you use tools to measure? What do you do in your clinic?
There are, as you know, scales that are used in the measurement of fatigue. A lot of them have traditionally been borrowed from other diseases or just general measures of fatigue. I think there have been some recent attempts at looking at fatigue very specifically with vis-a-vis myasthenia, as illustrated by the tool, the MG symptoms patient reported outcome measure. And I think that that has provided some interesting insights. But even apart from that, from our other clinical trials, as you mentioned, even though the clinical trials tend to be heavy on patients with mild or moderate disease, there is a clear burden of reported fatigue for these patients, as measured by the general tools and even the MG specific measures.
Right. I think you make the good point that the conversation should be happening in clinic, talking to them about it, and of course, getting a sense of how bad it is. And I do think what you're bringing up also is that for future research, we should start thinking about developing measures that are perhaps MG specific. And this is sort of my futuristic view, right? That may be able to separate out neuromuscular fatigability symptoms from the actual fatigue symptoms. And I think that is going to be a challenge because fatigue is also often related to physical exertion. The more they do, the more tired they feel. They say, I just work for half an hour and then I have to lie down the rest of the afternoon. But it remains to be seen how we would do that. I think there's also a role for biomarker exploration in terms of objectifying that fatigue and finding ways to deal with it. But before that, what do you do with patients now who complain about fatigue? How do you manage them? How do you treat them?
One is exploring what other possible underlying medical conditions might be contributing to that. That's the easiest part, perhaps. I think the second part is kind of getting a better understanding. So, as you pointed out, is this fatigue activity dependent, or is it just like a pervasive feeling throughout the day? If it is activity dependent, I think there you can have the conversation with the patients in terms of modifying or streamlining their expectations on how to deal with it. And as we all of us do in our day-to-day life, pacing ourselves and just modifying and also adjusting our expectations of what can we do reasonably given our disease. Yeah, another factor at play is the medications that we use. They have side effects and they can certainly result in fatigue as well. So sometimes, as is always the case for us, trying to use the least amount of medication to while ensuring patient stability, I think that's a constant target for us to be trying to hit. And then the fourth part of it is also the impact of myasthenia as a chronic disease and other conditions causing issues with psychological problems. So depression and anxiety are also coming to the forefront in myasthenia conversation, and there has been some meaningful research in those areas. Certainly, again, just scratching the surface, and we need more information on this and better tools to assess, as you mentioned, and strategies for addressing it.
Do you tend to use your mental health professionals fairly frequently, or do you tend to treat them? That's number one. The one other point I wanted to make before I turn it over to you, this is a last point, is you talked about medications. One of the things I find is I wear my general neurologist hat and look down at their list of medications, and you'll find so many things that are not necessary. And I think more often clean up medication lists and remove medications rather than add medications. But back to you with that question here.
I absolutely agree with that. I think we underestimate the impact that our actions have on our patients' lives, and the medication and the collection and the growing list of medications
Yes.
that they have is exactly to that point. I absolutely agree 100%. And we need some solid research around this part. What does it mean to provide multidisciplinary care in these patients? And as our therapies become more complex, the interplay of all of these therapies, which we won't know from clinical trials and systematic studies.
One of the things that really puzzles me is this MG related or not? I don't think I still know it.
So I agree. I think your previous point about having some kind of biomarkers that might inform us better and guide treatment or at least management approach would be really helpful.
Thank you, Dr. Habib. Great to have you here. Always good to hear your views. Thank you very much. And to our viewers, thank you for being here today.